Welcome to Module 1, Lecture 1, Community Health Advocacy and Social Movements, CHP 305. So your Module 1 objectives are analyzing the social and economic factors that make communities vulnerable, listing important social movements in community health, and understanding the link between social movements and health advocacy. So your Week 1 readings, Health Activism and Public Health. You have Community Health Advocacy, Body and Soul, your textbook, and the film United in Anger, which we'll be discussing at the end of the week, and a few videos about advocacy. So what is advocacy? As defined by the International Council of Nurses, it's blending science, ethics, and politics. Advocacy is self-initiated, evidence-based, strategic action that health professionals can take to help transform systems and improve the environments and policies which shape their patients' behaviors and choices, and ultimately their health. So as defined by Dr. Sanalui in her 2005 article, community health advocacy entails advocacy by a community around issues related to health, however that community is defined or formed. So in the article, there was an idea about communities of circumstance and how they may form around a shared issue, an experience, a leader, or a locale. And I like that the article also references McQueen and our article from CHP 300 talking about different groups that define communities and how we don't have a clear definition of community, and therefore it's important to advocate in the way that a particular community feels is right for them. So approaches to advocacy, there's grassroots or bottom-up advocacy, which is based on the needs identified by the community members themselves. Empowerment is the bigger focus here, shifting the power structure from institutions and bigger systems to people who are trying to make change. There's Health Social Movements, which talks about this quite a bit, the Zoller article. And, you know, it could be bottom up from the level of a neighborhood or a community of ideas, a community of memories, a community of crisis. And so we also have top-down advocacy, which experts, that being, it could be a government, non-governmental organization, and a hospital, maybe they define what the health standards are and what health is, and they try to identify the health needs of communities. So that's a top-down way of doing it. So health social movements, as we saw in the article, they're really about changing social norms, policies, and medical practices, entrenched systems like that. Say, for example, the women's health movement of the 1960s and 70s. We'll get to hear more about that in other classes during the BAS program. There's groups and unions for retired persons that helped to pass Medicare in 1965. There's also, there's also environmental health activists who really advocated for the creation of the Clean Air Act in 1970, the Clean Water Amendment in 1972, and the formation of the EPA, the Environmental Protection Agency. There's IBFAN, the International Baby Food Action Network, which started with the movement against Nestle and corporations that promote mothers giving their babies infant formula instead of breast milk, even when the mother is capable of breastfeeding. And then Physicians for National Healthcare is a really excellent group. We'll be looking into them more and hopefully get a guest speaker from their group during this program. They've done a lot in the way of advocating for affordable care in the United States, and they're a very active and excellent group of professionals who've come together just for advocacy. So there's the Center for Science in the Public Interest, who lobbied for a trans fat ban, and we'll also talk more about that, but it's a nutritional intervention advocating for healthier options in terms of eliminating this more dangerous source of fat from our food production system. So no matter the approach, advocacy requires organizing, which is preparing the people, the medium, so whether it's posters or flyers or a video or whatever the medium is, the message. So really being precise about what the ask is and what people need, and then mobilizing, generating actions, because we can do a lot of organizing, planning, but if there's no action, nothing happens, right? And then needs assessment is it can be a more formal part of advocacy. It could be as simple as going around and asking your neighbors what they need and taking that to the neighborhood council or whatever, but it could be formally done with experts and the community working in collaboration, getting a consensus of all the people doing this assessment and what the identified needs are, having a study design for collecting primary data, which is asking people through surveys and focus groups and all kinds of ways what the needs are, and as well as the published literature or secondary data, which gives a context or an evidence base that these things are needed and why it's important. So there's also good study design that's used for a formal needs assessment, a review process where everyone, the community, the experts, the researchers, the recipients of, if it was a program that came out of it, how they felt this whole thing went. And then there's a plan for disseminating and using the findings, because in community health, we place the importance of all the actions that we do and all the work that we do on benefiting the community. So the levels of advocacy that we are, just some examples are at an international level, something like the United Nations Declaration of Alma-Ata for advocating for primary care of underserved populations is a major statement, an advocacy statement and imperative that was published in the 1970s. And on a federal level, there's organizations such as the Indian Health Service, which is an actual part of our U.S. government, which advocates for the needs and health of American Indians and directly provides health services as well as a form of advocacy, which we'll also look at in our textbook and how that's done, which our example from our textbook, The Black Panther Party, is a community level advocacy effort and initiative, which also like our film that we're watching this week, ACT UP, that's also a community level advocacy group. And the example I have here is We Act for Environmental Justice, which is a wonderful group in Harlem, New York City that I had the privilege to work with, which advocates for the clean air quality and clean environment for residents of the neighborhood of Harlem. So on an individual level, there's definitely advocacy that you might think of as such as a translator, which is a one-on-one relationship between a patient and a provider and someone who's bridging that cultural gap and language gap and things like that. So on a personal level, but also these translators, I was able to attend a PNHP, Physicians for National Healthcare, presentation of translators at Harborview Hospital in Seattle, and they do so much. They even, I mean, often their part of their work is translating culture between the patient and the provider and making sure that the healthcare is culturally competent and meets the needs of the patient instead of, letting them fall through the cracks or letting them leave without a proper understanding of what they need and how to improve their health outcome. So next, in our part 2 of our lecture, we'll talk about advocacy strategies. So until you watch the next one, think about these different levels: law and policy, civil demonstrations, collective bargaining, popular and public education, which we'll be doing a lot of in this class, formation of groups, organizations, contacting representatives, incorporating health literacy into patient appointments. At what level are these strategies aimed at and implemented? So we'll see.